this project, I will be outlining our patient, Mr. WG. His chief complaint is, I'm having chest pain and it goes into my left shoulder and down the inside of my left arm. I'm also having a hard time catching my breath and I feel somewhat sick to my stomach. Mr. WG is a 53-year-old white male who began to experience chest discomfort while playing tennis with a friend. The discomfort intensified to a crushing sensation in the middle sternal area, and the pain seemed to spread upward into his neck and lower jaw. When Mr. G complained of feeling nauseated and began rubbing his chest, his tennis partner was concerned that his friend was having a heart attack and called 911 on his cell phone. The patient was then transported to the nearest ED and arrived within 30 minutes of the onset of pain. His father died of a heart attack at the age of 55 and also had diabetes. His mother died from breast cancer at the age of 79. The patient has one sister, aged 52, who is alive and well, and one brother, aged 44, with hypertension. The grandparents may have had heart disease. He's unsure. He has a history of smoking 40 packs a year. He is married and lives with his wife of 29 years, and they have 2 grown children with no known medical problems. He's a full-time postal worker for the past 20 years, and before that, he was a baker for 8 years. Occasional alcohol use averaging 2 beers per week, and he has never used street drugs. His medical history is hypertension for the past 12 years, which has been poorly controlled due to patients' poor compliance. He also is a type 2 diabetic for the past 5 years. He is status post-acute MI 5 years ago, which was treated with cardiac catheterization and PTCA. He has been experiencing stable angina for the past 4 years. He has BPH for the past 2 years, and he has hypertriglyceridemia, or elevated triglycerides. His current medications are amlodipine 5 mg POQAM, glyburide 10 mg POQAM, 5 mg POQPM, Escasa, ESCASA, 325 mg POQD, and Gemfibrozil, 600 mg POBID, and Terazosin, 1 mg POHS.